Hello, I'm Caitlin,
And I'm Kate.
and today we're going to be talking to you about vocal hygiene.
Vocal hygiene is an unfamiliar concept to many people. It can be defined in several ways. According to staff members at the Western Teaching Support Center, vocal hygiene refers to increasing or decreasing vocal behaviors and or spending time in environments that encourage appropriate voice and verbal communication. Regardless of your client's goals, vocal hygiene is a useful component of any voice treatment.
As Kate just mentioned, vocal hygiene can be helpful for anyone, but it's particularly beneficial for those who rely on their voice for professional success. We like to call these people professional voice users. Some examples include teachers, telemarketers, and singers.
Individuals with certain voice disorders may also find vocal hygiene to be especially beneficial. Some organic disorders, resulting from structural or neurogenic impairments, including laryngopharyngeal reflux, vocal cysts, and candida, to name a few. And then there's some functional disorders which result from phonotrauma. These include vocal nodules, vocal polyps, and edema. This list is by no means inclusive, but rather should give you a general idea of the disorders we might see in therapy.
There are three main components to vocal hygiene. They are vocal health, vocal abuse, and vocal misuse. These terms might seem synonymous to some, so it is important to make a distinction between the three. When discussing vocal health with the client, we want to get a feel of their lifestyle and what types of behaviors could be influencing their voice. Vocal abuse refers to speech and non-speech behaviors that place unwanted stress on the vocal folds. And finally, vocal misuse involves using a voice that is characterized by atypical behaviors related to the vocal parameters.
To help you better understand vocal abuse and misuse, let's discuss some examples. Abusive behaviors can include things like yelling, throat clearing, verbal arguing, and talking in loud noise. While misuse may be characterized by using an inappropriate pitch for your age or gender or singing beyond your appropriate range. Now, it's important to remember that not only singers and professional voice users do these things, but we tend to do these things in our daily, typical, everyday lives also.
When preparing to implement vocal hygiene into voice therapy, there are a few things we want to keep in mind. Our mission is to promote a decrease in behaviors that are causing inflammation to the vocal folds. It is important to make your expectations clear, as patient adherence is key. However, you as the clinician must also be realistic. You may be asking your client to make a number of lifestyle changes, so be understanding of the fact that it could be challenging for them. The best thing you can do is be a supportive educator.
To minimize behaviors of abuse and misuse, we suggest some of the following strategies. When trying to get someone's attention, you should use gestures as opposed to yelling to them. You should practice gentle throat clearing, which Caitlin will now demonstrate for us.
What you will want to do is inhale and exhale through the mouth as silently as possible. This will be followed by a swallow and chin tuck. I will now demonstrate. This might be difficult for some, but it comes along with practice.
Thank you, Caitlin. Some other behaviors that would help you avoid abuse and misuse of the voice include taking short, periodic vocal rests, especially if your occupation requires excessive use of your voice. And rather than whispering, we should adopt a more confidential voice or confidential tone when we're speaking.
Now for some good vocal hygiene practices. First and foremost, hydration is key. Your vocal folds, like the rest of your body, need to be hydrated. A general rule of thumb for how much water you should have daily is to drink half your body weight in ounces.
For example, this water bottle contains about 32 ounces of water. If I drank approximately 2 of these water bottles per day, that would be about 64 ounces, which is just around half my body weight of about 120 pounds. We also would recommend that you avoid coffee, alcohol, and soda or any other substance which is dehydrating to the vocal folds. Also, tobacco products are especially irritating to the vocal mechanism known as the larynx, so these should be avoided as well. Each and every one of us has experienced feelings of dryness in our mouth upon waking up, or the need to clear our throat when we have a cold. As a result, we may rely on behaviors that are actually harmful to the vocal folds, like those we mentioned earlier, in an attempt to alleviate the pain and discomfort. An example of this would be the constant throat clearing. Rather than utilizing phonotraumatic behaviors, we can use products which may provide some temporary relief. For example, cough drops that do not contain menthol. Menthol and eucalyptus are both two substances that are harmful and irritating to the larynx. Some examples of cough drops we should avoid, although we might think are beneficial to us, would be Halls. I know we all love to have a taste of them because they are quite tasty, but we do want to be careful of exactly what types of substances the cough drops contain. So that's something to be aware of. Also, we can buy a humidifier or a steamer to assist us in temporary relief. And finally, there are also lubricating sprays which can be found in local markets and drugstores.
While each clinician will devise their own approach to therapy, most will include the following: education, targeting a decrease in inappropriate vocal behaviors. This includes reducing loudness and reducing the amount of talking. And lastly, as we mentioned already, is monitoring daily water intake, because this really is essential.
Many people are unfamiliar with the anatomy of the vocal mechanism. The lack of education can often lead to misuse and abuse of the voice. As SLPs, we can serve as advocates for educating the public. Some ways we can do this include holding seminars for our coworkers and students, getting other professionals involved, and educating our children. By doing some of these things, we hope to encourage people to take better care of their voices and preserve a very important part of the body that is oftentimes overlooked.
Thank you for your time, and best of luck practicing vocal hygiene.
Thank you. Good luck.